Is there anything else that you think that might be relevant to our hypnosis providers out there in thinking about using hypnosis with Latino or Hispanic patients?
Well, I think they have to first have some training in what is a culturally sensitive intervention for Hispanic patients. So knowing the culture, if they can, providing the intervention in Spanish would be a plus. If they need an interpreter, well, they can do that. But even if they speak a little bit of Spanish, that will help with the connection with the patient. Also, being formal in the way to talk. They talk to each other in a formal way. That's something I had to get used to because in Spain we are more informal. Also, talk about their families. Sometimes be patient and schedule them with a lot or some extra time because sometimes they just like to illustrate their question or their answer with a story or something about their family, something that happened to them. So it's important not to interrupt them, to let them talk because they need to feel heard and listened to. It's part of that connection with the Hispanic participants, just kind of let them talk about themselves a little bit. So that in research can take some extra time. But yeah, it's important to connect with them. Sometimes the scheduling with them is going to be tricky because their jobs, they don't have sick leaves, they have weird schedules, or they have 3-4 jobs, 2 at least. So sometimes I just have to schedule the session with them after hours. It's kind of difficult, but you have to adjust a little bit to them, asking about their families and using the techniques, adapting a little bit to this self-confidence, self-esteem approach that they need so much, especially when they live in the States.
Gotcha. And do you use hypnosis in part to help increase self-esteem?
I cannot do it because